Welcome everybody to this Workplace Health Without Borders webinar on waste workers and COVID. We have a wonderful assembly of speakers today who are really knowledgeable on this topic, and I'll be introducing them, and feel free to comment in the chat box. After they all speak, we will take questions and discussion. So I'm really happy today to introduce our first speaker, Vanessa Cruvinel. Vanessa is a professor of epidemiology at the University of Brasilia. She's the coordinator of the extension research project she'll tell us about, Stop, Think, and Disposal. She was a visiting professor at the University of Toronto, which is where I was delighted to meet her. She was at the Dalai Lama School of Public Health, and she's now co-chair of the Workplace Health Without Borders Waste Workers Safety and Health Committee. So Vanessa, warm welcome to you.
It's a pleasure to be here and to speak about the waste speakers. I live in Brasilia, Brazil. I am professor at the University of Brasilia. And today we are going to talk about the prevalence and impact of COVID-19 in waste speakers in Brasilia. So here we are. We are located in the middle, in the center of the country. And Brasilia is the capital of Brazil. We have 3 million inhabitants, the highest per capita income, and a huge social inequality. So Brasilia located for almost 60 years, the largest open dump in Latin America and the second largest in the world. And there were a lot of waste pickers working there. The closure of the dump site was determined by the Federal District Court in 2017. And we have, for example, other institutions and organizations like Whwb launched a campaign to close the 50 largest dump sites in the world, reinforcing what the National Solid Waste Policy advocated here in Brazil. So these are pictures that we took of the waste pickers working in this large open dump here in Brasilia. So Brasilia, the capital of Brazil, generates 9,000 tons of solid waste every day and has more than 2,000 waste pickers, including those who work on the streets. There are different types of facilities where the waste pickers work. So here you can see a waste picker working on the street, waste pickers working in an indoor facility, and other working in the new triage centers here in Brasilia. So they are exposed to all occupational risks like chemical, physical, ergonomic, biological, and psychosocial. According to some of our papers, unfortunately here in Brazil, people are not used to discard correct their trash. So we interviewed almost 400 people to know about where and how they discarded, especially their medical waste. And most of them, 73%, discarded their medication of common residues. 8% stated to have disposed in the sink, and 7% in the toilet. So according to some of our researchers, we understood that most of the waste pickers were exposed to medical waste, and most of their accidents here in Brasilia are related to sharp objects. So this systematic review showed that despite the closure of our open dump, since people are discarding incorrectly their trash, the waste pickers are exposed to this occupational risk. So the contextualization of the problem, as you can see, COVID-19 pandemic started here in Brazil in 2020. And since the beginning of this pandemic, workers who work in urban cleaning have maintained their activities throughout Brazil, but the waste pickers had to stop their work for months there was a decrease of 4% to 19% in the generation of urban solid waste in Brazilian capitals due to the COVID-19 pandemic. This decrease affected the commercial activities, and the suspicion of recyclable programs affected the financial incomes of the waste pickers. In this unfavorable context, the most comprehensive policy for collectors was the federal emergency aid proposed by the legislature. They received a month aid of 600 reais, which means more or less $100. And here in Brazil, they received an additional emergency help with 400 reais, which means $80 per month, only for 3 months. So the collection and sorting for recyclable waste was halted in several parts of the country. However, this activity here has resumed subjected to the presentation and implementation of safety and risk mitigation plans, evaluated and monitored by the health surveillance. So all the waste pickers to come back to work, they stopped here for 3 months, and to come back work, they had to have a new plan of operation, like the transportation, storage, separation, and processing of waste involving levels of protection, like 72 hours of storage of waste segregation at source before management, use of safe and secure of personal protection equipment. Some of them didn't know how to use them or how to use the correct equipment of protection, and kept away from work the elderly and chronic sick waste pickers. So it was a very hard moment for the waste pickers here in Brazil, and especially for the ones who could not come back to work. They faced a hard time to keep surviving. So there is a question: waste pickers protect the environment and public health, but who protects the waste pickers? In this sense, we have a program here at the University of Brasilia. The name is Stop, Think, and Dispose. We have many areas of interest and of actions, such as health education, occupational health, environment monitoring, epidemiology, health law, economy, medical waste, social inclusion, women's health, mental health, primary care, geriatrics, toxicomeral exposure, water surveillance, and waterborne disease. And since 2018, we are working together with Whwb, and we have a special committee there. The name is WASH, Waste Workers Health International Committee. We have members from many parts of the world with the same aim to help and to protect the waste pickers around the world. So Susan and Yuta and Ana Gando are members of this committee too, and we are very proud of many things that we are doing since we are working together. So we developed many flyers to sensitize about correct disposal of waste. We conduct a question and answer about hygiene habits and COVID-19 to clarify and also to sensitize groups of informal workers, and in particular, recyclable material collectors, about individual and collective protection measures to prevent the COVID-19 pandemic. All these material are translated in Portuguese, Spanish, English, French, Creole, and also Italian. So we developed an animated cartoon about the prevention of COVID-19 in partnership with WASH and Whwb, a statement to recognize waste workers as essential workers. And this year, in 2021, with the help and with the funding of AIHI, we trained more than 466 waste pickers about how to use correct the respirators. So we gave them PFF2 masks and talked with all of them and trained them how to use it correct. And fortunately, we are very happy because they are working with these masks and they are very, very used to use them. So it was very nice. And regarding the crisis of COVID, we helped the way speakers with basket foods during this time. So we try to do as we can. This is the animated cartoon.
Catadores e catadoras de materiais recicláveis saibam como ir contra o coronavírus.
So all the way speakers received this animated cartoon from WhatsApp, from the cell phone. And all the flyers and material that we produced, they received by phone.
A melhor forma é lavar as mãos com água e sabão. Não der, use álcool em gel. E atenção, sempre ao sair de casa, use máscaras que cubram nariz e boca. As caseiras também funcionam, mas devem ser lavadas a cada uso. Tenha o máximo cuidado ao lidar com os resíduos do lixo. No trabalho, use sempre máscara, luva e uniforme. Se possível, troque diariamente seu uniforme ou roupa de trabalho e não misture com a roupa de casa. Para lavar, use água com detergentes ou água sanitária misturada com água. 50 ml de água sanitária para cada litro de água. E nas ruas ou local de trabalho, manter pelo menos 2 metros de distância de outras pessoas. Em caso de tosse frequente, espirros ou qualquer sintoma de gripe, ficar em casa ao menos 14 dias e evitar contato com outras pessoas. Recomendado paracetamol e dipirona para tratar a febre relacionada ao coronavírus. E ir ao hospital apenas se os sintomas se intensificarem, em especial o cansaço e a falta de ar. Atenção, jamais tome etanol ou água sanitária. Essas substâncias podem causar problemas sérios à sua saúde. Com estes esforços, o coronavírus não tem vez e a sua saúde e da sua família estarão mais protegidas. Se você ainda tem dúvidas, telefone para o Disque Saúde, número 136.
So this animated cartoon was prepared in the beginning of the pandemic and was distributed to all the way speakers during the time they were not working. So in this year, in 2021, we decided to identify the cases of COVID-19 among the way speakers in Brasilia, Brazil, prior to their vaccination. So there are almost 1,000 way speakers working in the triage centers after the closure of the open dump. And we conducted a transversal descriptive study with all people listed as way speakers in Brazil from 28 co-ops. So in Brasilia, there are 3 types of waste recycling facilities. The first one is Group 1. They are the recycling complex and waste recovery facilities provided by the government of Brasilia. So we have 3 of them here with 832 waste speakers working there. So after the closure of the open dump, the waste speakers were relocated to this kind of triage centers. So Group 2, there are sorting plants where waste speakers manage recyclable material by their own initiative with 334 waste speakers working there. And Group 3, there are mechanical and biological treatment plants provided by the government of Brasilia. There are 2 with 295 waste speakers working. So regarding the Group 2, they have better working conditions because they receive recyclable material from public offices and specific locations in which they have established an agreement with households and commercial business to regularly collect recyclable material. So in this case, they have their own trucks. In the case of Group 3, There is the most robust machinery there, in which conventional residues with a lot of organic matter are processed. However, the waste pickers sort only the recyclable material out of the organic and contaminated waste fraction. It's a closed space without proper ventilation and with a very strong smell, making it a very unhealthy space. So we did the collection of the data between May to June 2021. We conducted a questionnaire to know about some variables like gender, age, level, education, address, workplace, comorbidities, and also symptoms of COVID-19. And from all volunteers, a finger drop blood was collected and a rapid test was executed on site, and we conducted an interview to collect this social demographic data. So regarding the results related to the characteristics of the participants. So 878 waste pickers participated in this study. 57% were female. The median age were 34 years old. Most of the samples self-declared themselves as mixed race or Black. 4% was illiterate, and most of them had unfinished elementary education. The median age of years working the co-ops was 4, because there are many new places they are working now, because when they worked in the open dump, the median age of work was 10 years in the open dump, and they are the same waste pickers who work in group 1. According to the serology results, 11% were positive with IgG and IgM detected. And by work groups, group 1, they had 12% of positive tests, group 2, 7%, and group 3, 15%. So there was an important difference between group 3 and group 1 and group 2. So according to the self-reported symptoms during the data or blood sample collect, the participants declared the history of symptoms in the last 15 days, and the most related were almost 40% short breath, almost 30% cough, and chills 26%. And of total, 8% declared having a comorbidity. Hypertension was the most self-declared comorbidity. And one very good thing is that most of them didn't go to be hospitalized in a hospital. So they was just treated at home or in primary care. So some important considerations. The waste pickers are workers who should be considered essential to society since their work protects the environment and public health. Unfortunately, in Brazil, they are not. In the scenario of economic and public health crisis caused by the COVID-19 pandemic, they have to deal with some adversities. This because they were double vulnerable to be contaminated by waste and without working with during some months, resulting in no income to survive. Thus, this study is particularly important to know the prevalence of this disease in waste pickers to guide public policies to protect these workers during this pandemic. And analyzing the seroprevalence between groups, group 3 was the most affected by COVID-19. This difference may rely on difference between workplaces and also the kind of material they manage. And therefore, there are some occupational risks that might be influencing the COVID-19 prevalence between these groups. The group 3 from the mechanical and biological treatment plants has the worst environment, working place, and with no appropriate refectories. These waste pickers process waste from conventional collection in Brasilia, so the kind of material is not so good as the others. The sites known as waste recovery facilities have standardized structures. In Group 1, they were built with the support of the local government to include scavengers from the structural dump, which was closed in 2018. And these structures have large sheds, mats, press, forklifts, and suitable place for sorting waste, and also administrative areas. And this could contribute to better work conditions than in Group 3. Group 2 has, in general, better work conditions than the others, and also better quality of material. The associations and co-ops are in warehouse arose from private initiatives, companies and collectors collectives, and we identified that the prevalence of COVID-19 in waste pickers in Brasilia sample was lower than the general population of our city. That is 16%. So it's a good news. According to our next steps, we want to follow up with the waste pickers and their family to analyze the impact of COVID-19 in their lives, to extend the respiratory training to all the waste workers in Brazil, and also to measure as air exposure of the indoor facilities. So that's it. Thank you, and sorry for my mistakes.
Thank you so much, Vanessa. That was wonderful. We'll hold questions until the other speakers. So I'm now going to introduce our next speaker, who is Whwb. Jutta is a professor in geography and the director of community-based research laboratory at the University of Victoria. She has a PhD from the University of Tübingen and previously worked at the University of Newcastle, Australia. Her research is focused on transversal socioeconomic, cultural, political, and environmental waste-related challenges.
Thank you so much, Marianne, for the invitation to speak at this Whwb conference, and all the contributions you made to this conference. So I would like to speak today about first of all, introducing the project under which umbrella the research specifically on COVID-19 has happened, which is the Mapping Waste Governance Project. Then I would like to introduce briefly the research activities we did and share some of our findings and final considerations. So the work we're doing with waste pickers happens under a larger research collaboration with universities in the countries shown here in Brazil, Argentina, Nicaragua, Tanzania, Kenya, and also in Sweden, which is called the Recycling Networks and Waste Governance Project, which is funded by the Swedish Research Council and also by the Social Science and Humanities Research Council here in Canada. So the key focus in that research is on the key actors. And here I'm showing some pictures of the key actors in Brazil, which are the waste pickers. In many other countries, they are waste workers. So here in the Global South, most of the material which is actually recovered and diverted by waste pickers. In most countries, there is no official selective waste collection for recycling, so it happens through the waste pickers. And while they are doing that important work, they are also only remunerated with 5% of the revenues which are generated along the recycling value chain, which maintains them in poverty. In Brazil, there are between 400 to 600,000 waste pickers, and of which around 38.6% are organized in waste picker organizations, associations, or cooperatives. And their socioeconomic characteristics is that most of them are Afro-descendant, and a significant part of them is illiterate. And 24%, like 1/4 approximately, has only basic education. So that means that they have very little access to formal employment, and also have to live on the survival level. Most of them who are organized, they earn more than a minimum wage. So the overall objective of this project, Mapping Waste Governance and Recycling Networks, is to map the actors and processes that are involved in good governance, and to understand possible barriers and challenges in household waste management, as well as looking at factors that generate grassroots innovations in terms of waste governance. But the specific objective for this research, which was induced by the pandemic, was to learn how the COVID pandemic has impacted the work of organized waste pickers. And you see that the work in general tackles many of the Sustainable Development Goals, but also specifically the goal number 3, which is good health and well-being. So the research activities involved, of course, a larger team. First of all, Dr. Adalberto Azevedo from the Federal University of the ABC, and then Fabiano Harada, who is a consultant in waste management, and Solange Dias de Araújo, who is an independent researcher. Our key research question was to look at in which ways were organized waste pickers in the study region impacted by the effects of COVID. So what we did was, first of all, a literature review. We studied the literature, the current literature and studies who were focused on documenting COVID impacts. And then we did 2 interventions. One was applying a survey to 64 cooperatives and associations spread throughout the state of São Paulo. And here we used convenience sampling and snowballing based on the contacts the Fabiano Harada had with his work as waste management consultant. So he had already established contacts with these cooperatives throughout the state, and we could thus easily apply that survey and get in contact through telephone and email. And then we also applied a semi-structured interview with 22 cooperatives, which are working with us for quite a while in the waste management, waste governance project. And also we applied this interview to networks, waste picker networks, and one member of the City of São Paulo committee. And here also we use convenience sampling based on our existing contact. And then what we did with this qualitative data we collected, we did a thematic content analysis and axial coding. So here you see the distribution of our study sites. In the highlighted area is the metropolitan region of São Paulo, which is where the 22 cooperatives which we involved in the survey were located, and the rest were distributed throughout the state. So our findings in terms of from the bibliography, we consulted works from SEMPRE, the Pesquisa Ciclosoft, which gave us an indication as to whether the waste pickers, the organized waste pickers, had continued or interrupted their work. And we see that half of them had actually maintained their work, and the others had significantly changed their work routine, either by completely interrupting the work or by reducing the work or by having additional measures in place. And then also that data showed us that these cooperatives received diverse contributions in terms of support, financial and in-kind contributions. And here you see the different origins from these supports, from most of it coming from the federal level with what Vanessa has already mentioned, the support, the financial support provided during 3 months. There was a tiny little contribution by some states, also very significant EPR programs. However, their contribution mostly was not financial, but rather food baskets, very similar to the contributions by municipalities, which was sometimes food basket and sometimes financial help. And according to the study done by ABIS, COVID infections were 5.47 times higher among urban cleaning workers, which also includes waste collectors and waste pickers. And death levels were 6.5 times higher among that group. So with the survey, which was applied to 64 groups throughout the state of São Paulo, we found that in terms of financial support, really the most comprehensive policy support for waste pickers was that federal emergency aid, which reached almost all waste pickers with 600 reais per month. The support helped maintain the waste pickers, but it was a short duration and it had a very assistant character, and thus it did not support it was not a long-lasting support, and it did not help the waste pickers to adapt to this crisis. Also, in terms of the specific situation in the city of São Paulo, which has created this a recycling fund created by the municipal authority for urban cleaning, which provided support for registered waste pickers in the city. And those who were work autonomous, they got 600 reais, and those who were organized got 1,200 reais. So that was quite a significant contribution. However, that fund was a fund already dedicated to the waste pickers and would otherwise have been used for capacity building or other structural support needed by the waste pickers. In terms of livelihood impacts, the semi-structured interviews with the 22 cooperatives gave us a lot of qualitative data. And here we found that while most groups actually, they had most groups, the income and their financial situation was quite compromised by the pandemic, with only a short period of support. It did not cover the running costs at home. And many of the groups did not receive the support. And some were even forced to close their operations by the government, and thus they lost the established collection points in their communities. And for some groups, the materials which were still coming from the selective waste collection, they came quite contaminated, and thus it made their work much harder, and thus also the value of the work was reduced, while the health risks were increased with the more contaminated waste. In terms of long-term survival impacts, the most significant finding was actually that the COVID impact and the consequent economic crisis has created structural problems in waste picker cooperatives and associations, which many of them were not able to pay the regular cash, the regular bills, water bills, electricity bills, renting the space, etc. And so several of the cooperatives are really at the verge of losing their infrastructure because they are not able to maintain those payments. And here is a quote from one of the waste pickers, which attests that, saying the majority here, if they spend a week without working, it creates a very big impact on what they have to cope with in terms of debt commitments. So there are debt commitments individually, but also in terms of the cooperative, the collective. And finally, speaking on the health measures and impacts, cooperatives, they very quickly reacted to the health impacts by putting in place protective measures like hand washing, surface cleaning, using masks, etc. But in some cooperatives, in addition to these measures, they also implemented strict social distancing with dividing the work into several shifts, and also having the meals at different times so that smaller groups were in the cafeteria. And some groups even, they implemented the quarantine of the materials. So they received the materials and left them sit for 2 days, and then started to work with those materials. And 5 groups, actually, they had a complete stop, ordered by governments. So all groups, actually, they indicated that the pandemic, and specifically the measures of closure of their workspaces, had impacted the mental health of waste pickers, and particularly the most vulnerable and elderly members who who had to stay at home. They actually were mostly affected by mental health impacts. Not being able to work, not being able to be with their cohort has really had severe impacts on their health. Over the period of our study, we had 17 cases of COVID infections were reported in 5 of the organizations, but no death. However, of course, this number might be underreported because it could be that not everybody spoke up on COVID infections. Throughout our study region, there was a lack of access to COVID testing. One cooperative actually used their own resources to provide COVID tests to their members. So the pandemic has significantly impacted the livelihoods of the waste pickers, and also has left structural impediments for many of those groups to recover after the pandemic. Nevertheless, despite these threats, there were several coping mechanisms in place, and some of these entailed, first of all, the solidarity amongst the co-workers with sharing resources, with sharing food baskets amongst those who were most needing, and also sharing other resources amongst the groups. And another coping mechanism was actually to stimulate communication through Facebook, to help people overcome fears and specific mental health issues. And finally, also a strong coping mechanism where the diverse seminars which were organized by the National Waste Pickers movement, and the webinars which stimulated communication and networking amongst the waste pickers. So these are the strengths of these organized waste pickers. They are well connected, and I think through the pandemic they have learned how to take advantage of the online environment for communication and capacity building. And with that, I close, and I'm awaiting your questions. Thank you.
Thank you so much, Jutta. As I mentioned before, we can hold questions until after our next speakers. So our next speakers are Sonia Diaz, who is a global waste specialist for Whwb, which is Women in Informal Employment, Globalizing and Organizing. Her work is focused on the intersections of waste and citizenship rights, including gender, human rights, decent work conditions, and public policies. And with Sonia is Ana Carolina Oganda, who's a research consultant at Whwb. And she has worked actively in the Gender and Waste Project in Brazil, and was the senior researcher for Whwb's Informal Economy Monitoring Study. So thank you so much, Sonia and Anna, and we look forward to hearing from you. Thanks.
Thank you very much, Marianne, for the invitation to share some of our research and interventions during COVID-19. We're very honored to be part of the working group from Whwb, and we're happy to be here. Well, just a little bit of an introduction about Whwb, Women in Informal Employment, Globalizing and Organizing. We are a global research, action, and policy and advocacy network that seeks to improve the status of the working poor, especially women in the informal economy. And we work with 4 sector groups: street vendors, waste pickers, domestic workers, and home-based workers. And we try to provide support in terms of helping them in the process of organizing and in the process of representing their interests and demands. We carry out statistics and research, and we advocate for more inclusive policy processes at various levels. In cities that we have local teams, at the national level, and also in the global advocacy arena. And we try to push for equitable trade, guidelines for equitable trade and labor, and also inclusive urban planning, and for social protection policies. Well, just a bit of introduction. Who are the waste pickers? We will work globally as well as nationally and locally. And we have, you know, within the waste picking sector, we may speak about different subgroups within it. So a working definition for us could be that waste pickers are those who collect, sort, and/or process household or commercial or industrial wastes, be it on the streets, working on cooperative sorting facilities, or in open dumps. And according to the ILO Green Jobs report, we have 20 to 24 million people in the world living out of recycling activities. And these workers, they may work on as an autonomous worker, or what we could say non-organized, at least formally organized, or they can work in organized ways, be it through cooperatives or even forming second-level networks of cooperatives. Some of them have unions, like in Pune. Some of them have formed federations. And some workers may work in some medium to small enterprises. So they can work individually or as a family unit, or they can work in collectives in their cooperatives. And Latin America is home to the strongest cooperative movement in the world, and particularly the countries of Brazil, Colombia, and Argentina have been quite an inspiration to other workers worldwide. Well, when COVID-19 hit us all in the world last year, we quickly organized ourselves to respond to the demands of our workers. And we quickly started to produce and share information on COVID-19 for all the 4 sector groups that we work with, and of course with waste speakers, and to support different initiatives around the world in terms of producing safety protocols to cope with COVID. We share tools and policy recommendations to support the advocacy efforts of our membership organizations. Whwb is, I should have explained earlier, but Whwb is a very unique network because we have universities, we have development agencies, and also we have membership-based organizations. So organizations of these 4 sector groups who are part of our constituency, and they are actually represented in our board of directors. So we were quickly responding to these membership-based organizations linked to Whwb. And we were trying to influence the policy processes in order to include informal workers' demands. So we start very early when COVID-19 hit us all, a rapid assessment, mapping on social protection, drawing from the connections we have on the ground in more than 60 countries around the world. We started the 12 cities study. You'll learn a little bit more later on with Anna, my colleague. We started tracking local and national policies. And in April, we started the mapping of impacts on COVID-19 on Brazilian cooperatives. I'll talk about that a little bit later. And we also advocated globally for vaccine for workers as essential, under the status of essential workers. And we also supported mutual aid activities in terms of providing assistance to numerous emergency aid efforts and campaigns across the globe. And we supported the campaign for PPE and for food baskets. And accessible information on protection, and we provided support for the different organizations that we work with in terms of helping them cope with the difficulty of interacting with one another in the context of physical and social distance. So providing assistance in constant communication. So very early, we spearheaded a campaign, an effort together with partners like Universidade de Brasília, here represented by Vanessa, the Whwb, which is the health foundation of my state, Minas Gerais, and we produced some guidelines for waste speakers. And these guidelines, they were translated in more than 15 languages, including Mandarin and many other languages. And with the support of the network that we have, they were disseminated across the world. So as early as April, we started a mapping of COVID-19 and cooperatives. Let us just recap a bit. When COVID-19 hit us in March, we, people from ABIS, the Association of Brazilian Sanitation Engineers, we are part of the technical chamber of ABIS, we quickly started to talk amongst ourselves and discuss what could we do to support the waste sector, which has, in the case of Brazil, garis. They are formal collectors, so they are formal workers with a different kind of protection. And we also discussed the issue about informal workers, because in Brazil, some cities, they have municipal recycling programs in partnership with collectors, informal collectors of recyclables. These people don't collect household waste per se. And so one of the things that we decided at ABIS that would be important that we issued a recommendation to stop the work of recycling the cooperatives, exactly for the reason of protecting people's health, so that we could work out what would be the best protocols to support the cooperatives. So we issued this recommendation, and many municipalities closed the cooperatives until some data and information were gathered, and we could respond with proper protocols. In the meantime, we, as Whwb, we partnered with ABIPEC. ABIPEC is an association of the industry that produces a package for hygiene products. And they are part of what is called in Brazil, the reverse logistics program. This is an EPR, an extended producer responsibility, is our EPR program. And so there are different programs in Brazil regarding EPR. One of the programs is the De a Mão para o Futuro, led by ABIPEC, who very early started to issue grants for the waste picker cooperatives that belong to the program. And together with them, we decided to map what were the impacts of COVID-19 amongst the nearly 140 cooperatives that belong to this EPR program. So we started a mapping in 2020. We conducted different Google surveys in April and May, and our main goal was to see what was the operational status of the cooperatives that belong to the ABIPEC program. We wanted to map the impacts in terms of health, in terms of the production of the cooperatives and what were the coping strategies of these cooperatives. So our sampling was 100, we had 130 cooperatives that were mapped last year, and we managed to get responses from 86% of our database. And then in 2000, and then this year, we again came with a second round, and we had a sampling of 143 cooperatives, and we managed to get responses of 95% of this database. And we were again mapping impacts in terms of the operational status, whether the cooperative sorting center was closed or fully operational. And also we wanted to map access to vaccine. A bit of some highlights, and you can find some of the information, more detailed information in the links that I have shared on the chat. So by 2020, last year, most cooperatives had stopped their activities, 73%. We have some reported cases of COVID-19, 51 suspected cases and 1 confirmed. And there was a 28% drop in terms of gross revenue of the cooperative. Remember, we are looking at the cooperative at the enterprise level, okay? And 0 low production due to the interruption of collection and of services. By 2021, in our sample, 80% of the cooperatives had resumed normal functioning. We had a relevant increase of COVID-19 cases. From the 51 cases, suspected cases that I said we had in 2020, we already rose to, they reported 895 cases. And we have interestingly, we had an increase in gross revenue. And this is related to something which is related to the commodities price. It's not because the waste pickers were earning more money per se, but there was an increase in terms of prices of recyclables. And some of the coping actions in 2020, they were busy, the cooperatives, together with the national movement of waste pickers, and also an NGO called Pimp My Carroça, and a pool of many organizations from civil society, from local governments and universities, supported waste pickers, organized and unorganized waste pickers, to have campaigns to raise funds for food baskets, for PPE. There was the development in many states of safety protocols to work in recycling. Different safety protocols were produced, and there was the development of, in some cases, in some cities, the survey reported that there were some specific public policies for access to basic emergency income and financial support. And there were the start of some training for waste pickers to adapt to the new virtual format. And in 2021, the survey already reported the Cata Saúde Viraliza online project. I will speak about that, and other initiatives as well that were going on in Brazil towards in terms of providing capacity building for workers to cope with COVID. And they reported bills to ensure waste pickers' priority in vaccination. And there was a continuity of campaigns for food security of workers. So what we could see in terms of the COVID-19 2020 and 21 mapping is that cooperatives were able to quickly implement a set of COVID-19 protocols, which speaks to what Jutta said earlier. In our sample, last year, 2020, 98% of the cooperatives research already had adapted the usage of mask, gloves during in the early months of COVID-19. 90% had already adopted the use of disinfectants and many other measures. We can see that the vaccination rate at the time of the survey in the country, when we did the 2021 sample, 69%, over 69% of the population in Brazil had already its first dose. And among the waste picker cooperatives, the rate was around 78%. There were many municipalities that issued some decree giving priority for vaccination for waste pickers cooperatives as a result of the advocacy that waste pickers had done in this context, cities. Well, what we can see is that cooperatives have functioned, at least in our sample. We're speaking here about cooperatives who are part of the reverse logistic program and enjoy perhaps, different support they received, a specific fund, a grant from ABPEC, and of course, they managed to access the grants issued by the federal government. What we could see in our sample is that the cooperatives, they function as a kind of cushion for waste pickers to cope with the impact of economic crisis. So, last year, as COVID, during I guess, August, perhaps, we quickly saw that the COVID-19 was here to stay, and we at Whwb, we managed to get the funds from OSF foundations, the Open Society Foundations, and this funding we directed to Brazil to different work lines. One was to provide support for the National Secretariat of the National Movement of Waste Pickers to support them with specific projects that they have. The other fund, the second part of the fund from OSF, we channeled to an online capacity building project for waste pickers, organized, that is those belonging to cooperatives, and non-organized, those who work autonomously. And our idea was to provide through a WhatsApp online capacity building information on OHS, information on COVID myths and facts, to support the workers with coping strategies and to support them in the threats and opportunities that they were facing since last year. So very briefly, you can have detailed information in the links that I shared. Our Carta Saúde, we started the formulation, the drafting of the project last year, but we started the online capacity building in March, 1st of March, which is the International Day of Waste Pickers. And we started with around 500 participants. And we created, besides the formally enrolled participants, we created a transmission list so that we could reach out others who could not enroll for the course with the same content. And we had a 4 months course, and we included gender dialogues. We had thematic sessions on many issues like the Brazil's social policy system, Brazil's national health system, and lives on vaccines. And we produced dedicated content like audio and videos on many issues. And we also ended up at the end of our course in July with a Latin American exchange to provide an opportunity to share our learnings from Carta Saúde project and also learn from colleagues in other countries in Latin America about how they were coping with COVID-19. So you have a lot of details in our webpage. It's shared here. You have contents that can give you more details. So in a nutshell, what are the main achievements of this online capacity building? It helped to create synergies between organized and non-organized waste speakers, but not only between these workers, but also synergies with the organizations who work with these workers, like the NGOs and national movements. So there were greater collaboration between workers themselves and supporting organizations. The course was very adaptable and very flexible, and we were very quick to react to different inputs that the waste speakers, the participants, shared with us within the working groups that we had with them, so that we could adapt content or better prepare a given content in a format that would be more user-friendly for them. We had a good balance of topics in the sense that we realized that waste speakers were completely tired of talking about COVID. So what we did was to have the content in different modules in ways that we mixed COVID-19 content with other topics that are very important for the livelihoods of waste speakers, like how to calculate the service that I provide as a cooperative or the service that I provide as an autonomous worker, and many other topics. And we were able to engage with city officers who wanted to be part of the project somehow, and other experts. We had a collaboration with Utah, and we used materials produced by Vanessa's team, and many other materials and contents from different organizations. And the course provided a safe space for workers to exchange experience and ideas, and to have some moral support during isolation felt during COVID-19. And we use basically WhatsApp. We had 10 WhatsApp groups. The participants were divided in different WhatsApp groups, and we also use Facebook Lives, which were transmitted also through YouTube. So now I pass on to Anna, and then I'll come back for the closing.
Thank you, Sonia. So I'm just going to share some brief highlights from WeGo's global study on COVID-19. And since April 2020, as Sonia has mentioned, WeGo led a global study in 12 cities across the global north and south. And it is a longitudinal mixed methods study that looks at the multiple impacts on informal workers' livelihoods. And we're considering primarily the 4 sectors that we work with, which are waste pickers, street vendors, home-based workers, and domestic workers. But in some of the cities, we're also interviewing relevant sectors for their advocacy purposes. And so round 1 of the study was conducted in June and July of 2020. And round 2 was conducted in June through August of 2021. And we're currently processing the quantitative and qualitative data. So I'll be showing some preliminary findings here. And again, while the study is not representative, we do have a quite large sample here of 2,292 participants. And the study relies on quantitative and qualitative tools that were designed after multiple discussions with worker organizations and local research teams from the onset of the pandemic. And this really speaks back to our principle of doing research for and with informal workers and their organizations for local advocacy purposes. And from our sample, we have waste pickers in 9 of the cities who were surveyed, and we're also participating through semi-structured interviews. And you'll see here that our sample in the 9 cities for waste pickers includes 288 women and 283 men. We also look at several themes in the study, both from the quantitative and qualitative perspective. And these also refer back to previous global studies that we've conducted at WeGo. We look at impact on informal workers' livelihoods and impacts on households. We look at value chain disruptions, particularly from the sector lens. We are also interested in capturing food insecurity, access and barriers to social protection. So whether or not the workers received cash or food grants. We're also interested in mapping the health concerns brought forth by the workers and the worker organizations. So we're trying to track in round 1 and 2, the occupational health risks, access to health services, and more specifically in round 2, access to vaccines due to vaccine inequity and our global advocacy campaigns. We're also quite interested in understanding whether or not workers are experiencing increased stigmatization and violence at the workplace. We're also exploring the impacts of care responsibilities on workers' livelihoods, their coping and adaptation strategies at the organizational and household level. And we're also very much interested in understanding the key multiple roles that informal worker organizations provided to their membership bases. So here I just wanted to present a few of the health-related data points from the study, and we are more than happy to discuss this in the Q&A. So here I'm just presenting some of the occupational health risks reported by the waste pickers in round 1 and 2. And what we can see here is that both men and women are reporting increased risks, in particular for exposure to medical waste, exposure to COVID-19, heavier labor, and longer work hours. And we also see that men are reporting greater exposure to hazardous materials in round 2. On sources of protection, what we see is that in June 2021, a high percentage of waste pickers are reporting at least one use of PPE, personal protective equipment. But a key finding for us, and also an advocacy point, is that many waste pickers across all the cities are reporting the difficulties of covering the costs of PPE themselves. So in round 2, we have 77% of waste pickers mentioning that they're covering the costs of PPE themselves. 23% are reporting that they received PPE support from their worker organizations. 21% are reporting that they received PPE from charities or civil society, and only 9% are reporting support from local or other levels of government. Thought this would be an also important point to mention is the access and barriers to vaccines that we're covering in the sample. And we've got 32% of women and 26% of men waste pickers reporting that they've taken at least one shot of the vaccine, and the total sample here would be 29% for waste pickers. But we're also hearing from them that the main barrier is still access. So 34% are reporting barriers related to access, and we still have 10% reporting hesitancy. So before I conclude, I just wanted to share some needs and lessons from the grounds through the waste pickers' voices. And overall, there's a clear demand for greater recognition and for local governments in particular to do no harm. So we're tracking a lot of stigmatization against waste pickers considered to be vectors of the disease from the onset of the pandemic. We're also hearing a lot of the need for local governments to step in and support for work equipment and decent and safe work infrastructure, including PPE. But as Whwb was also mentioning, and Sonia, there have also been reports of workers' agency and support and solidarity throughout the pandemic. And we've heard primarily from waste picker leaders across several of the cities on how COVID-19 has presented them with an opportunity to disseminate more information and raise awareness on protection and how to follow safety protocols at the multiple work sites that waste pickers are working in our cities. So to end, I just wanted to raise the voice of one of our waste picker leaders from Accra, Ghana, when he talks about the greater attention and awareness to protection. And he says, I can say in particular for me, during the crisis, I think my health has improved because previously I didn't normally wear protective gears very well. And also hand washing and other things that COVID has taught us to do. These are things we had not been doing, but we're doing them for now. So we feel a bit safe, although the crisis is here. So I'll pass on to Sonia, who will present some concluding thoughts, and again, happy to share some more insights during the Q&A.
So Thinking forward, I think it's important for us to highlight how COVID-19, in spite of all the hardships we heard, from the previous speakers and also from, the global study, I think the importance of this moment in time was to highlight how essential informal waste speakers are. Formal waste speakers as well, but here we're talking about the informal ones. So it's very important that we keep on highlighting the need to invest in building formal workers' capacity to deliver services in complementarity with formal systems and in ways that can strengthen their capacity to withstand or recover from all sorts of impacts, be it economic, health, and climate change. And here it's very important that we talk about the notion of resilience as a very useful notion in the current COVID outbreak. And the importance of highlighting the interconnection between health, economic, and environmental crisis needs to be further explored. We need to rethink and reshape solid waste management systems to understand the role of informal workers. They feed the recycling markets with raw materials that sustain the production. They are service providers for many cities where waste collection is not done at all if it weren't for the work that waste pickers do. And we need to recognize them as contributors to public health and environmental stewards and provide the essential protection they deserve. Thank you very much.
Thank you so much, Anna and Sonia. And very, very wise thoughts at the end there, Sonia, that I think we all need to listen to, because such a majority of the world's workforce are informal workers, and it's very important for us to remember them. I know we don't have much time left in the amount of time we assigned for this meeting, which was an hour and a half, but I think all our participants, or all our speakers, and I know myself, are prepared to stay on the line longer. So we certainly would welcome anybody who wants to ask a question or make a comment. So one thing that really intrigued me about a few of the presentations was the use of WhatsApp as a communication tool. I thought that was terrific, that you have a video, an educational video that you disseminated on WhatsApp, and that you started WhatsApp groups. And I think we could all learn from that in terms of ways of reaching hard to reach people with health and safety messages. So I'm wondering if Vanessa or Sonia, who mentioned this, or any of you would like to comment on how effective this is as a method. Vanessa, do you want to say anything about it?
Yeah. So WhatsApp here for us is an important channel of communication. So they have our WhatsApp, and so they can bring us some news and some thoughts and some questions, and we can change with them many informations, and it's very good. It's very good because we cannot stay there all the time, but we can be in touch. So for us here in Brasilia, it's super nice.
Great, thank you.
If I may add, our online course was completely designed to be on WhatsApp, and it was all the modules. So we had to prepare all the content, in two ways. We had always to be mindful that some people are literate and some are not. So this gave us a lot of work, because all the content need to be prepared, both in audio, video, and written format, so that we could reach out people in different ways, and with, if they were literate or illiterate. We also, we used Facebook as a library, because we need to work on WhatsApp. We need to understand what are the possibilities, but also the limitations of WhatsApp. So when we designed the course, we decided to share the main content through WhatsApp groups, and we divided the participants in 10 different groups. This required us to have a facilitator and also 2 supporting people. So we had always a technical staff and way speakers who were part of the working group of Cata Saúde. And in each of these 10 groups, we had 3 people. Besides, the coordination, I was in all of the groups, paying attention to everything, and some of my other colleagues who were working on this project in the coordination team. Besides that, we devised the Facebook as a library. Okay, so there is an architecture that you need to take, great care. The other issue that I want to raise is the issue of hate and discriminatory language in WhatsApp. As we all know, Brazil's election was won through hate discourses, the last presidential election through WhatsApp. Okay, was one of the main source of hate discourse. We had to monitor. I listened to all the audios and I identified within our participants some hate discourse and some sexist discourse, and we had to be ready as a team to neutralize that. So I'm over WhatsApp, but I'm also want to wear if you design anything through WhatsApp, be careful and plan for it in many ways so that you can counter a lot of the difficulties, technical difficulties, but also hate discourses and other things.
Thank you so much, Sonia. And Andrienne, I was just wondering, you had raised that comment in the chat, a few comments. I was wondering if you're willing to unmute and speak. We're really glad that you're here.
Very much for these presentations. It's very, very useful. One of the things, and I was very intrigued by your dissemination technique, because I think that a lot of us, when we're trying to get out really important information, that's the barrier that we struggle with. And with everybody now not being home and not being in the workplace, they're now, all over the place. My question was, how did you generate your distribution lists to include all of those workers that are informal, that are hard to reach, that don't? So how did you get to having their WhatsApp handles?
So if you're asking about the Cata Saúde, which was an online course, we had a registration for the course. We had I think from December to now, my memory fails me, perhaps till February, we had a call for those who wanted to enroll. And when they enrolled, they would add their WhatsApp. Okay, so we had the permission from them to use their WhatsApp, and then we created the groups. Okay, so at a certain point, we closed the registration for the course, for the formal participants of this course. And there were many other people who missed the deadline or whatever, okay, had a problem in the registration. And so we created a transmission list. These people in the transmission list, people who approach us and said they wanted to receive our material, okay? They only received the content. We would share the links for our lives, for all the material, but they would not be part of the WhatsApp classes. We had classes, we had opening time for the WhatsApp groups. The WhatsApp group would stay closed just for content dissemination during a few days, and then on a certain on a given time, twice or thrice a week, we would open during 2 to 4 hours, and the participants would interact with us and with one another, and share whatever they want or ask. And we also had hour, a special hour with a specialist. On a given day, we would have a specialist who would be available for consultation within the WhatsApp group about a particular subject. So our participants asked things they wanted to know about vaccine or any other subject. So there was this was more or less how we did.
Great. Thank you so much, Sonia. And did you have participants from all over the world, or was it just people in Brazil?
It was a Brazil capacity building, and we reached out all the states in Brazil.
Okay, that's great, because we have some people here who are familiar with waste workers in different parts of the world. In fact, I just asked someone if she would want to talk, but I haven't heard back from her. Jandira, if you can hear me, if you're willing to talk about Angola, that would be great. Or Yuta, you may know too. But if anybody has some thought about the applicant, oh, there you are. Good to see you. Yes.
Hello, everyone.
Yeah, Vanessa and I met at Jandira. I don't know if you're still in Australia, Jandira,
Yes,
but it must
yes.
be very late there or very
Yes.
early. I don't know. So
Yes,
thank you
it's-
for joining. Do you want to say anything about waste workers in Angola?
Yes. Thank you very much for the honor to join this conference, despite being through Zoom. I'm currently a PhD student here at the University of Queensland, here in Australia. And I'm doing a PhD focused on waste pickers in Rwanda, where it's my country of origin. Currently, in Angola, the situation about waste pickers, it's pretty critical because Angola faced war for many years, since 1975, and it ended up only in 2002. So, and the rate of poverty increased considerably. Most of people currently work in the informal sector, and unfortunately, Angolan government, despite of facing several problems in order to incorporate everyone in terms of jobs opportunities, still not recognize waste picker service providers, because in Angola, the waste management is very poor, especially in the suburban area where the government has no access because of the houses they are all built from it to close to each other. So I'm doing this project because I identify myself as waste pickers, because I had the polio since I was child, and I faced a lot of stigma. And I see that waste pickers, because of the work that they do, they face also stigma. This is one of the reasons that made me to do this project, and it's something that I really fascinate about, and see how waste pickers, despite of the difficulties that they face, they still happy people, they still move forward despite of the poor situation. And the contribution of my research is to convince my government that the waste pickers, as Professor Sonia, Professor Vanessa, and other people who spoke, and I apologize for not mentioning the name because I'm not quite good with the names, are great contributors, not only for health sector, for the environmental sector, for the social sector, and we need all to come together to incorporate those amazing workers in order to be recognized not only at the local, national, but around the world, because those people are incredible, are amazing. So the contribution of my project is to convince my government that those people are providing great contribution to Angolan community in particular. And also they are helping to diversify Angolan economy, because our economy still depends on oil sector about 75%. And by recognize those people is a way to diversify our economy and give also, I will start to see waste instead of waste, but potential resource This is basically my project. I'm about to go back to Angola because I was supposed to go back to Angola to do my field work in person, but because of travel restriction, I couldn't go back. So I'm just hoping that everything goes well so that I can go back, and I cannot wait to interact directly with the waste pickers and to get to know them more about their life, all those things. Thank you so much.
Oh, thank you so much, Jandira. It's wonderful to hear that, and you're very inspiring. Thanks very much. And you brought up a topic I'd like to ask Yuta about if nobody else has another question, which is, Yuta, I think you were a major person in the idea of getting waste workers declared as essential workers. So do you want to tell us something about that? Like, how did that go and what was the response?
Yes, actually, I need to maybe expand a little bit because my talk was primarily on the situation of waste pickers in Brazil, who are much more organized and already recognized. And as Jandira was saying, in Africa, the situation is much more precarious in terms of, first of all, the stigma is a huge hindrance. And then second of all, the lack of organization. Most waste pickers work autonomously and are not organized. So there it is even more difficult to recognize that these people are actually environmental stewards, recovering materials for the circular economy and all these contributions. However, in the case of Brazil, there has been already significant conversations with waste pickers and their organization, and particularly the National Waste Pickers Movement, on these contributions the waste pickers have in terms of environmental health by recovering these materials, but also on public health, because of the contact they have to door collecting these materials and diverting them into where they belong, into the recycling sector. So they are essential in the sense of contributing to environmental and public health, yet that role is not adequately recognized at the official level. Through our research, and also other researchers have stated strongly how important their contribution is to the public sector, particularly in terms of health. And I think with the pandemic, it has become more obvious that these people are actually taking care of these materials and part of the waste. And so also the National Waste Pickers Movement has also declared themselves as essential workers, and the push is to get them recognized, and that means to have them access PPE and also to be adequately remunerated for the work they are doing.
Thank you so much, Yuta. Yes, I agree. So I don't see any more questions posed, and we've gone past the time. So I think we can thank our speakers very, very much. I know I got a lot out of this, and I think it's very inspiring, the work that you are doing.